Thank you for joining us. My name is Joette Springle, Vice President of Business Development and Marketing with Legacy Healthcare Services. And today we're talking about an important update that healthcare providers and Medicare beneficiaries alike need to know about. And that's the 2025 changes to the Notice of Medicare Non-Coverage, NOMNC. To help us break it down, we've invited Julie Galla, VP of Clinical Strategies from Health Pro Heritage, to walk us through the changes and what they mean for outpatient therapy services. Hi, Julie. To start, can you explain the purpose of the Notice of Medicare Non-Coverage, or NOMNC?
Hi, Joette, of course. So the NOMNC, or NOMNC, however you prefer to say it, that is a notice that Medicare providers are given to the beneficiaries when Medicare is expected to stop covering a service, such as an outpatient therapy, while there's an ongoing course of treatment. And this is a crucial document because it alerts that patient that they might now be responsible for the cost moving forward if that coverage does end. The notice also gives patients the opportunity to take action, such as appealing the decision if they agree with the termination.
Can you explain to our audience what are the key updates for the 2025 regarding the NOMNC, especially as it relates to outpatient therapy?
Good question. So for 2025, the updates are focused on making sure that patients are informed when that coverage for physical therapy, occupational therapy, or speech therapy is ending. The updated NOMNC form, which is the CMS 10123, will be required when Medicare determines that a beneficiary no longer is meeting those medical necessity criteria for continued therapy. So this could be because they've reached the limits for their therapy or their condition no longer requires that level of care. The big change here is that the NOMNC must be delivered to the patient at least 2 days before coverage is terminated, so that way they have that time to appeal the decision.
I have a question. When exactly should providers deliver the NOMNC to patients, and why is that timing so important?
The NOMNC needs to be given, again, at least 2 days before the coverage ends for Medicare. And that's essential because it's going to ensure that time enough to understand that their therapy may be stopped and gives them that opportunity to file an appeal if they disagree with the decision. So that timely delivery is going to be key here to allow that patient to take appropriate action, whether it's seeking another opinion or making arrangements for continued care.
Does the NOMNC apply only to outpatient therapy services, or does it cover other types of services as well?
Oh, I love that question. So the NOMNC applies to both outpatient and inpatient services under Medicare. It's not just limited to therapy services either. So if Medicare coverage is expected to end for services under both Medicare A, which is your inpatient service, and Medicare B, so outpatient therapy, the NOMNC must be issued. For outpatient therapy, this typically happens when a patient no longer meets that medical necessity for continued therapy.
So are there any differences between how the NOMNC applies to original Medicare versus, say, Medicare Advantage plans?
Yes, there are some differences. The NOMNC is required for both Medicare Part A and Part B services under original Medicare, but for Medicare Advantage plans, there are some variations. While the NOMNC is still required when coverage is expected to be discontinued, each Medicare Advantage plan may have its own specific rules or processes for how to deliver that notice. Providers need to verify the guidelines for each Medicare Advantage plan to make sure that they remain in compliance with those rules.
Gotcha. So for our listeners, if the providers do need more information about these changes and how to implement the NOMNC correctly, where should they go?
Providers should become familiar with and check out the official CMS, or Centers for Medicare and Medicaid Services website, for the most up-to-date guidelines. This page offers comprehensive details about the NOMNC, including the updated forms, and it also helps provide some of that information about both original federal Medicare as well as those Medicare Advantage plans. And it's a great resource to ensure compliance with all the changes and making sure that providers are following the correct procedures.
That's great advice, Julie. This has been so helpful, and thank you for sharing all these insights. It's clear that the 2025 NOMNC changes are an important update that will help Medicare beneficiaries stay informed and make more empowered decisions about their care. So I appreciate everything you shared today.
Oh, Joette, thank you. It's been a pleasure. I'm glad to help. And it's always important for both providers and beneficiaries to stay up to date on these changes to avoid any of those
Yep.
surprises down the road.